there is a lot of confusion around Medicare supplement plans versus Medicare replacement plans. I'm here to clear some of that up. My name is Anna Kaminsky, and I'm here with ABC for Health. What are Medicare supplement plans versus replacement plans? The key word here is Medicare. Medicare, these are programs that are for people that are on the federal health insurance program called Medicare. Medicare has a Part A and a Part B. This type of insurance does have a lot of coverage. It offers a lot of coverage to people, but it doesn't pay for everything. So sometimes people will sign up for one of these other plans to help cover some of those costs. Starting with the Medicare supplement plans. Medicare supplement plans are also known as Medigap plans. These are supplemental insurance policies with private companies that will cover some of the costs that aren't covered by the Medicare Part A and Part B, also known as Original Medicare. Replacement plans, on the other hand, are known by a couple different names as well. They're known as Medicare Advantage plans, Part C, or MA plans, which stands for Medicare Advantage plans. These are plans that are offered by private insurance companies, and these private insurance companies have to be approved by Medicare. Medicare will actually be paying these private companies a certain amount of money in order to manage your benefits, but then your benefits are fully managed by that private company. Supplement plans, people will ask, what do they cover? Supplement plans tend to help cover some of the things, again, that aren't covered by your original Medicare, which is also known as A and B, such as co-payments, co-insurance, and deductibles. In many states, there is a kind of standard Medigap policy where people, regardless, will get the same basic benefits, but some companies may offer some extra benefits, extra perks for signing up with their company. The supplement plans will, again, cover the medical portion of it, but they actually don't offer the prescription drug coverage for the most part. If you want to get prescription drug coverage, you're probably going to want to sign up for a standalone prescription drug plan, which is known as Part D. Again, matching with that Part A, Part B, and then Part D, which is the prescription drug coverage. If you're looking for a plan that kind of has that all included, you might actually consider joining a Medicare Advantage plan where if you leave that original Medicare, you move into that Part C Medicare Advantage plan, a replacement plan. Sometimes they'll offer drug coverage as well. The replacement plans, getting back to the replacement or, again, Advantage plans, Part C plans as they're also known, there are many different types of plans. The HMOs, you may be familiar with health maintenance organization plans that they'll kind of be managing your care through one sort of doctor who has a network of different doctors and facilities where you can go. There are other plans, though, that offer different types of flexibility, maybe the preferred provider organization, private fee-for-service plans. There are some plans that are for special needs plans for people with special healthcare needs, and HMO point of service and medical savings accounts are all the different types of replacement plans. For more information, you can look at the Medicare website, medicare.gov. We will offer some links at the end of this presentation. A lot of times people want to know who's eligible and how do I go about joining one of these plans. The supplement plans or Medigap policies, as we talked about, the important part actually for both of these is that you have access to Medicare Parts A and Part B. Part A is often free for people, although some people do pay for the Medicare Part A, which covers generally hospitalizations. Medicare Part B, which generally covers the doctor's visits, and there is a premium associated with Part B. In addition to that, for a supplemental or Medigap policy, you're paying a separate premium to a private insurance company for that supplemental insurance. In Wisconsin, there's no age restriction on this, although you'll find in some states these Medigap policies are only offered to people who are over age 65. To sign up for these, you'll want to sign up when you first become eligible for Medicare, if at all possible, in order to avoid some of the underwriting things that happen. Sometimes there are exceptions and we'll offer resources towards the end. As for the replacement plans or Medicare Advantage plans, again, you need that Medicare Part A and B. You need to live in the plan's service area. Sometimes people with end-stage renal disease can't join these Medicare Advantage plans. And then you may or may not have to pay a premium based off of the plan that you chose. Some of them do offer it free under the amount that's just paid by Medicare to them, so they can offer you the plan for free, but many will also charge you a premium for that replacement plan. Movement between these different plans, it's good to know that there are rules around this. For example, if you already have a replacement or advantage plan, it's actually illegal for anyone to sell you a Medigap policy, with the exception of if you actually disenroll from that replacement plan or advantage plan back to original Medicare Part A and Part B, then you can look into signing up for a Medigap policy. And the other way around, if you want to go a supplement policy or Medigap policy and you want to switch to a Medicare Advantage plan, you'll want to kind of talk to somebody about that to make sure that you understand exactly what that means, what the coverage changes, if your network is going to change, your doctors. You want to do this research beforehand because you may or may not be able to get that Medigap policy back if you did want to go that direction. There are some resources for people here in Wisconsin that are looking to navigate these confusing systems. The Medigap helpline is a fantastic place where counselors can evaluate your options with you. For the prescription drug coverage, Medicare Part D, as we've called it, the prescription drug helpline, Part D helpline is offered for two different kind of groups. Those who are 60 and above will call the prescription drug helpline, excuse me. And those who have a disability may call the disability drug benefits helpline that are listed here. Again, I mentioned to you that we do have these sources listed. A couple of things from the Office of the Commissioner of Insurance with a guide to health insurance for people with Medicare. Some of the websites from Medicare.gov that give you a little bit more of an in-depth explanation of some of these advantage plans and so on and so forth. That's pretty much the information that we're going to provide here. If you want to keep your finger on the pulse, you can visit our website at www.healthwatchwisconsin.org, where you can send us your healthcare story. You could send us an email, or you can ask us a question. If you're watching us on YouTube, be sure to like or subscribe to the Health Watch page. And thanks again for coming and listening to us. We hope to see you again.